Ladies and gentlemen, get ready for an exciting conversation with a remarkable gynecologist who brings not only expertise, but also vibrant passion for patient care. Known for his skillful navigation of the NHS system, our guest is a true champion for women's health, providing compassionate care and supporting his colleagues with equal dedication. Please join me in welcoming the dynamic Dr. Yousef, who is here to share with us his wisdom and experience and infectious enthusiasm with us today. So welcome, Doctor.
Hi, Muhammad. Thank you for this introduction. I look forward to hopefully be able to help all viewers and they feel it's quite useful for them.
Amazing. No, thank you for making the time to meet us today and to share your experience and insight within the NHS. And in spite of me knowing you for many, many years, I actually didn't know something about you. Is what brought you to practice gynecology in the NHS, and what were your first impressions as an overseas doctor when you first arrived to this country?
So I practiced obstetrics and gynecology, obviously, back in Egypt. I had two specialties that I was thinking of. They are quite distinct between each other, but I don't know why I chose them. Maybe because I like the subjects. And quite often when you are in the medical school, that's what you do. So I had either ophthalmology or obstetrics and gynecology.
Wow.
And it's good that I only had two choices to think of. I was lucky enough to be living near one of the very big maternity hospitals in Egypt. And I had the opportunity to go there and visit people. And they make me more enthusiastic about obs and gynae, and I was able to go and join them for a few years.
Amazing.
I don't regret for a minute doing obs and gynae, and I like it. And interestingly, that when I wanted to do obs and gynae, my interest mainly was obstetrics, but I became more, particularly since I came to the UK, more interested in gynecology. And so now even I almost stopped doing obstetrics at the moment. The second part of the question is, what was my impression when I came to the UK? This was not the first time that I came to the UK. I had my sister. She came to the UK about 14 years before I came in. She had her family here, her husband, and I came and visited them twice before that. So I had some familiarity with with sort of where to go around and stuff. But still, obviously, that time I was coming for work. I arrived in January. It was very cold, quite dark, short days. So it wasn't really something that you...
Amazing start, yeah.
Soon you will get used to it. Just trying to find your way in. The hospital where I worked, it was really nice people, and I was lucky also to be able to have like 2 weeks. It was unpaid, but sort of observership to be able to familiarize myself with the system before I start working officially.
So what about the system itself? So the NHS system, moving from Egypt, where things are practiced differently, to the UK, where the NHS, with its complexities, did you find it difficult for yourself to integrate, or what were the main challenges at that time?
What I noticed is that we as people coming from abroad, often we've got the knowledge, we've got really, sometimes even I feel that we might have got even more knowledge than our equivalents. We do concentrate more on having the digesting all the information, reading from textbooks and stuff, but we were not mainly focusing on communication and dealing with people and patients and interaction with your colleagues. And that was the main thing. So obviously I was prepared a little bit by talking to colleagues. As I mentioned, in my hospital, we had almost about 30 doctors have already been to the UK, went and had their membership and came back, and I was able to have some information from them. But the system in the UK was very different. That it's built up on ensuring that it's patient center, and it's not like the disease center or knowledge center. And you have to make sure that the patient has a choice of different managements rather than what you think is correct for them. And you have to build up that in the communication with the patients. So that was sort of the main task for me is to be able to, and let alone obviously the language itself as well, is despite the fact that we were learning an English language in Egypt, the medicine, and we studied English from year one, but still English was different from what we learned. So yeah, there was a lot of things that you will encounter as you go along. You'll have to be prepared to also. When I first started working, I was working in the UK as the most junior doctor. Whereas when I was in Egypt, I was quite senior, having worked in the specialty in a very busy hospital for 6 years. And you have to respect that ranking when you come down and work in this place. So while you're trying to prove yourself and show yourself as from skills-wise, but in the meantime, you have to respect your seniors, no matter whether you have more experience more than them or not, and that's something that I'm fully aware about when I started working.
Thank you for sharing insightful thoughts about your journey and how you started in the UK. I can remember and relate myself is when I first started, I also found it difficult to understand English, although my English was very fluent when I came here, but it was really difficult to understand different dialects coming from different parts of the UK. It took me months or sometimes years to be able to understand all patients and what they say. So it takes a bit of training and a bit of patience and adaptation for us to understand how to understand different dialects here. And this is something that everyone has to be aware of when they come to the UK. In spite of you being very good in English, you'll have a different challenge with a different dialect from different people in the UK here. So yeah, I can relate to this as well. And it took time for me to settle in.
Yeah, so to add to this about the challenges in languages, especially that, which I've got to say, is that the understanding English over the phone. So when you are having to speak to someone over the phone, whether you're receiving a referral or you're making a referral, you lose that sort of ability to lip read and to understand what they are saying. So that was a big challenge, and to overcome that, I was often, when I get called to give an opinion, I would probably volunteer to come and physically be there just to make sure that I understand what is being said.
Having a phone conversation is much difficult than having a face-to-face conversation because you're kind of losing the emotional or the physical language that you kind of see when you talk to patients. But you've highlighted also two important points in your answer there, where you said you had 2 weeks of clinical attachment or observership. How valuable was this to you? I know you said it helped you to integrate in the system. And the reason I'm asking you how valuable is because now we see some of overseas doctors, they come to the system straight away and they come and work from day one. They don't have this observership period. I remember myself when I came in, I had nearly more than a month observership before being able to integrate in the system.
Absolutely valuable. I was going to say that I wish I had more than 2 weeks, to be honest with you. I think, you'll have to keep the balance between, because you are paying for your accommodation and you haven't started earning any money. And in the meantime, you have to use these 2 weeks very, very carefully, and they were very valuable. You will also have to decide. You don't just go and sit down. If you are an SHO or a registrar level, you don't just go and sit down with a consultant. You need to go really and shadow the person that you're going to be doing the job like you. So that's very important. You try to introduce yourself and to know the area, know where to navigate in your hospital. And also there are some other stuff that, your bank account you have to open, probably need to do something with the home office, and lots of things can be done during this, hopefully more than 2 weeks. And I think 1 month is quite reasonable. If you can even do more, that is very valuable.
No, thank you very much for elaborating on this. Would you think that NHS or the NHS as an employer should really factor this when they ask an overseas doctor to work for them? Because with the NHS shortage, there's no other way rather than to get doctors from overseas. But would it be sensible for NHS to consider this in their in doctors' contracts?
As far as I understand, I was involved with sort of bringing some MTIs, and I was a college tutor, so I have got some insight about how you come and work. So you basically, there are currently, as far as I'm aware, there are two ways of coming in, either through the Royal Colleges sponsor you, coming as an MTI, giving you an exemption from the PLAB, and then you get attached to one of the hospitals and you work for 2 years. From our specialty in Obs and Gynae, and I'm talking about on behalf of our hospital, even if the registrar or if the doctor is coming as a registrar, we try not to give them a registrar level, we give them an SHO level, but also we ensure that they've been shadowed for a period of time until we feel confidently that they, and to be honest with you, that's very useful. And they can be paid also for that time. We don't ask them to come earlier. So you're absolutely right. I think it shouldn't be just left to the hospitals, because each hospital is practicing differently. If trusts or if the Royal Colleges ensure that they are given in the contract period of shadowing embedded into that contract, that is very useful, and it's in their interest, because trusts they by the end of the day they want to make use of that doctor, and they don't want also to shock the doctor with the system and going into mistakes, a bad outcome at the end.
Totally agree, and thanks for sharing the experience about your hospital, because talking to other colleagues who comes from overseas and are working currently in the UK, they don't seem to be having this privileged start. They come and start from day one, which put them under severe pressure, emotional pressure, and can really cause unnecessary stress, especially when they're moving to a few challenging, areas like new country, new culture, new language, new NHS system. Everything is new to them, and the expectation is that they will start functioning from day one as if they were here all their life, which I think is not fair, and something need to be done about this. But thanks for sharing your experience about what you do in your hospital. I think it's very sensible, and it may also require that they need special mentoring, because mentoring will help doctors to settle in, overcome all these difficulties, and excel in their career, which is something also that's not done in all hospitals. So do you have any ideas about mentoring schemes in your hospital for overseas doctors or doctors in general?
You're absolutely right. I think that's probably what's missing in our, and when I say about hospital, I'm only talking about the Obs and Gynae departments. So I'm not sure what's happening in other departments, and I think there may be some not good examples as in Obs and Gynae. But I'm talking about Obs and Gynae because it attracts a lot of, it's a high risk area, and hence we as a departments are more particular about it. Mentoring is absolutely vital. It's interesting because we have some scheme for mentoring for junior doctors who are going through the system, but I'm not 100% sure whether we provide that. And I think you've highlighted something to me that maybe I should recommend to my departments. As soon as we have a new doctor that has never worked in the UK before, to be mentored, even if they have worked in the UK but not for a long time. So it'd be very useful to have some mentoring from other colleagues. I think you often come back home after a very difficult day, and then you don't know what to do, and you're faced with situations, and you're too scared to talk to someone about something that you may have felt that it's something went wrong, or how you deal with difficult situation in the future, and you don't know what to do or who to speak to. But if you have that system, I think, in place, definitely it will help. Often people, they do it themselves. Sometimes they can talk to a colleague from the same nation where they come from, and they try to get that information. It's not always, obviously, this information is not standardized. It's not, well, sometimes it reflects each individual. Because mentoring is, you have to remember that you do have to have some training in mentoring. It's not just being someone who had some experience and you can do mentoring. So I think it's an important subject.
You've highlighted really a very key point there, which is not everyone can be a mentor, because mentoring requires training, requires experience, requires ability to deliver things in the right way so that the mentee can really follow what being advised to. So yeah, I think it's important that they choose the right mentor, and we should maybe encourage all consultants to step up and take some responsibility in becoming mentors for overseas doctors, to help them navigate the system and help them get the right advice. Because as you also elaborated, some overseas doctors reached out to their colleagues from the same nation, like you said. And this is sometimes really unhelpful, because if they come from the same nation, they've been here for a couple of months, and they're advising someone who came just last week, they may think there's an experience there of 1 to 2 months. But it's like the blind leading the blind, because it actually takes years and years of integrating with the system, working at different level in the system, and also taking some leadership positions to be able to understand the system and how to communicate and how the HR works to give a right advice. So yeah, mentoring is essential, but need to be done in the right way. And it's important that we all invest in it. So the hospitals should invest in doctors and mentor them, and find someone to mentor them in the right appropriate way. So thanks for highlighting this point. Not only they are mentoring them into the NHS system, there's also the culture competency in the NHS. It's like the unspoken words between colleagues. So just wanted to get your views about how important is the cultural competency in the NHS, not the clinical, the cultural between colleagues and patients and staff.
The system, especially in the Middle East, especially in Egypt, I would say, is that, I don't know about other countries, but we run in a hierarchy, and we think that the senior person should give orders to the other person, and even you don't have to explain why, and you're not expecting the recipient of your instructions to challenge you about anything. And I think that's something that you learn, and you have to really be prepared for that. In Obs and Gynae, we do have certain situations where you either decide on delivering a patient, or doing an instrumental delivery, or continuing reviewing a CTG, and you cannot just think that you are the right person all the time. You have to be prepared to be challenged, and you have to back up your decisions by the knowledge, and not to be afraid of being questioned about it. So that's something that it's very important, particularly in Obs and Gynae, where we have midwives. They are well trained, and they have got all the knowledge. If you have some disagreement between you and other colleagues, that it should not happen in front of patients. So tactically, you have to make sure that you take your colleagues at a different place where you'll be able to explain or exchange ideas and come to a conclusion. It's always, there is a way of how you come to a conclusion, and if there isn't, then there are some escalation of how you escalate it to the senior person. Talking to other allied professionals, calling the lab to ask for investigations or to chase some results, they're all colleagues, right from the porter to the cleaner to everyone. You will have to be really respectful for everyone. And to be honest with you, it's not just because this is what the system wants you to do. It's in your advantage. If you make everybody happy around you and like you by being polite and respectful, and you will have them in your side. They will always want to help you. When you have a bad day in the morning and then you go in to work, and then you really haven't got your usual smile, and you find everybody around you just grim and maybe not having day as well with them. And it turns out to be that it's your fault at the beginning, because you actually didn't wash out what you came up with. And then you should just have the smile, and then you will find them respond the same way. It's very fascinating when sometimes, you speak to a patient in the clinic, and then a patient, I remember a patient comes in and say, "Oh, now you're smiling." So I just realized that I wasn't smiling. I didn't mean anything, but it just, maybe, I was trying to be serious so that I can show her some seriousness. But patients picks up on every single expression and the gesture that you do, stand up when the patient comes in, and it just show them respect. Yeah, it's a completely different way of how you deal with patients, how you deal with colleagues and your seniors. We used to stand up in Egypt when our senior comes in, and then now, I go into a room and then I don't see that happening, and it's fine.
Disappointing.
So it's absolutely fine. But I still see some junior doctors coming from abroad. When I turned up to a room, then they stand up and then shoulders. I think we are hierarchical in our countries a little bit too much. When we go for sometimes for nights out, so if there's any birthday or whatever, you will find everyone in the restaurant there, right from your healthcare assistant to the nurse to the midwife, and
That's true.
junior doctors to a senior doctor, all sitting together, chatting and stuff. So yeah, it's if you see it as a family and you work with them with all respect, you'll have it back.
We are all humans, right? We shouldn't forget that we are humans. If we are doctors or a nurse or healthcare assistant or admin or any part working in the NHS, we are all humans, and humans will connect regardless of their hierarchy. And I think the moment we leave hospital, we have to leave all our hierarchy back in the hospital and, behave like normal human beings. And even in the hospital, as you elaborated, in many overseas countries, there is hierarchy and there's expectation that senior will give orders. In the UK, this doesn't work and is not really encouraged because it's seen as unprofessional way of dealing with your colleagues. It has to be shared responsibility. There has to be exchange of communication. There has to be mutual respect between all parties. But something else you also highlighted is patient care. I also interacted with many overseas doctors where I see that their way of communicating a treatment decision to patients is also following the same hierarchy. So they dictate to patient what they think is better for them. But it's important to highlight to overseas doctors and anyone listening to this program, we have a responsibility as a healthcare professional to share treatment decisions and give them treatment options for all patients. And it's something also that is experienced here in the UK, not overseas. So what's your point of view? Because you actually have a direct patient contact and you do offer them treatment options. So if you could elaborate more on this so overseas doctors can understand how important it is to share treatment option and what patient expects from you as a doctor looking after them and offering them treatment options.
You have to, when you are taking history and you have to understand all things, all aspects about the patients. When you are giving management, you always have to give options. Even one of those options is actually providing no treatment. You'll have to be prepared to be able to explain what is the consequences of no treatment. And you should not be judgmental on the patient choice. You may feel that if I was in her position, I would have chosen this, or if I have a family member who needed this, I would have suggested that to them. I try not to impose any decision on patients. I try not even to suggest a better option than others. I try to explain the pros and cons of each option, and then it's a patient choice. Give them time to assimilate the information, try to use your piece of paper and drawing things.
Sure.
Because don't assume that the patients know. And that's bring me to another subject is actually the medical terms when we're talking to the patients and explaining to them. You think that they understand what uterus mean. You have to, know that there are different names for that uterus. You should understand what it is. A lot of people mix up the ovaries with the uterus and they don't understand the cervix is, maybe it's a different organ and from other places. And there is a lot of lack of knowledge for patients, and it's our duty to be able to explain to the patients as much as you can do with drawings, with pictures, giving them time, bring them back again to think about what your choices are. There's nothing worse than you have a complaint or a feedback that I wasn't told about this, or I was, I didn't know that this could happen or whatever. So you have to be really appreciating for each culture. You might not see someone who has no children who's coming and wanting to have sterilization. You might not see it in your country, but that's her choice, and you'll have to accept it. You'll have to, to explain there's a regret sometimes from patients, and But it's her choice. It's her, you can't say you've got to have children. It's not you. So there's a lot of things that you have to appreciate and respect wishes. And also, I think one of the things that I would recommend is that every doctor to do is to read the good medical practice from the GMC, because obviously, if you ever one day, hopefully not, that you have to go in front of a GMC panel, you would be asked about it. You would be asked, you haven't followed what the GMC guidance say.
Sure.
It's important. It's just very important part of the respecting the patient wishes.
Well, thank you for elaborating on this. I think it's really helpful to understand patient choice, understand that people come from different cultures, different countries, and there's something unique about the UK. You could treat patients coming from all over the world, and everyone come with their own culture, own understanding of their health, and own understanding and expectation from doctors. So it makes it a bit of a challenging for doctors as well, but I believe doctors should be clever and be adaptable in the way they communicate with patient and apply common rules like patient choice, listening, not being judgmental. It's one of the key things that I personally advise, and you've said it just now, which I'm happy that you've mentioned it, not being judgmental when you listen to patients' history or listen to their choice of treatment. Yeah, that's really, really helpful. Thank you so much for focusing on this. With the journey with overseas doctors, they come to the UK, they made all these sacrifices, left family home, left memories, left all, nice old days, and came to the UK to settle in. And they face all these challenges, and then they face the NHS and cultural differences, and they want to prove themselves. So they work really, really hard. So I want to discuss with you on the importance of work-life balance and how important it is to maintain the productive environment, but again, having this healthy work-life balance, because we've seen it a lot. There will be like 5-6 years past, and then you've missed lots of occasion with family, with kids, and you said, where are these days gone? So just want to elaborate that amongst your journey here as an overseas doctor, to all the listeners, don't forget you've got a family at home and there should be a work-life balance. So I want to take your views on this.
Absolutely. So I think we need to remember that, some doctors will be coming by themselves, and some doctors will be coming with a family, whether they got a partner or children, and it might be a little bit easier if you have a family, but you need not to forget that you need to look after your life, your family, children, if you have some, so that you don't lose these opportunities. As you said, a few years' time, you find yourself, you missed important years in your children's life. But it's also not just for that, it's for your own mental health. Because we never had 2 days off in our countries back home. We always had Friday off, and now when you come to the UK, you find Saturday and Sunday. There's a reason for that. You have to charge your battery and make sure that you do your hobbies, or just create a hobby if you're on your own. Make sure that you go and see your friends, read your books, to be reading, go to the gym, and look after your health as well, because when you're at work, you are expected to be 100%. You cannot be tired, and you shouldn't be tired. Sleep well. We do forget that. I remember we used to do so many hours in back home, and also it was like that actually when I started working in the UK. It used to be working 96 hours. Weekends, and then it's a lot of hours, but we used to do a lot of hours.
Wow.
Well, actually not 6 hours, So let's say 48 hours, and then the 8 hours on Monday, all without any break. And you'll be lucky if you have some few hours off. But that has changed. There are some working time directives that we have to follow, and you make sure that you have rest. So I think you wouldn't notice your efficiency and your performance is different until you do the change. So if you're working more than iron breaks, and then you suddenly decided, I'm going to have breaks, and when you feel the difference when you're working.
Absolutely. I think we all should embrace that there is a weekend, Saturday and Sunday, and try to, as you said, recharge, do something fun with the family, do something exciting, start a hobby or do something that you wanted to do all the time. And it's important that we embrace the luxury in a way that the system allows. You work very hard during the week, and then you come to the weekend, you have to really enjoy it and recharge and use it for what it's for, which is for you to recover and rest. Which takes us to a very interesting point about doctors generally, and perhaps overseas doctors specifically, sharing vulnerability. We all do mistakes, and the way we deal with mistakes overseas is different than we deal with mistakes in this country. But because of what we talked about at the beginning, where they don't have time to be mentored, they don't have to be time to be supervised, they usually carry on the way they deal with mistakes overseas to this country. And they don't share vulnerability, they don't ask for help, they don't ask for colleagues. So I want to ask you specifically, what's your views on this? And have you yourself made a mistake in the NHS? And what was the outcome of it? And what reflection have you got through it? And if any advice you would give to the listeners so they don't fall into any mistakes that you may have done in the part of your career here in the UK?
Yeah, I don't think anyone will go without any mistake. I don't want to be seen like I'm excellent, but luckily I didn't have major mistakes, I would say, that could have contributed to problems. I take everything that happens. I used to have some reflections. I even consider the example that I mentioned earlier about when the patient told me that now you're smiling, as a setback from my practice, and I remembered it until now, and I put it in front of my eyes. You always have some complaints. We always have to remember that if a complainant complained about something that you've done and you see it differently, it's your actions that had led to that. You may have had a good intention, but by the end of the day, this is what the patients perceived. Whether said certain words that you should not have said, or you acted in a way that you didn't mean it. I think it's important that you have to reflect. I'm trying to remember some examples I should have.
That's all right. We all deal with different things in a different way, but you mentioned something very important, which I didn't do specifically when I came to this country, which is reflection. So I only knew about reflection and how to reflect on your practice and how you deal with patients or colleagues or anything you do in life when I came to the UK. So something is very powerful that we never did before coming. I never did before I came to the UK. And it's something that doctors should also use. And it even took me years to understand it, and years to implement, and years to be good at it. It's not as easy as you switch the light and now you can reflect and now you can benefit. It's actually difficult to understand the term reflection and what it means. It was difficult for me. I'm not sure about you or maybe other doctors who are our listeners, but it was difficult for me to understand what is reflection, why is it important, why they keep asking us to reflect on things. And I didn't reflect in the first few years, definitely, but I became better at it now. And now actually it's part of my life. And it's actually something that I advise all doctors I'm mentoring right now, that they should reflect on their journey on every single day. Because without reflection, mistakes will just happen, accumulate, get bigger without you realizing how it's really affecting you and your career. So I'm not sure what's your experience with reflection. Was it something that you did back home? Did something that you practiced straight away, or did you have the same struggle like me?
I absolutely agree with you. I think we now learned really how to reflect properly. I think there is a little ego that is required if you are practicing in our countries, because you feel that you don't want to show a weak
vulnerability
to in front of anyone. But interestingly, that if you show humbleness and you show that you've acknowledged mistakes, and I'm trying to remember, in the early years of my work, I honestly can't remember exactly the details of the incident, but I think I may have done something wrong. And then I came to the consultant before even his knowledge, and I explained to him, and I think he probably wouldn't have noticed that. And I went and said, well, this is what happened, so and so and so. And then I said, but, I know that this should not have happened, and I'm sure that it's not going to happen again. Since that time, that consultant became my friend. He really appreciated me very well. That
Absolutely.
I acknowledged the fact that I've done a mistake, but honestly, I cannot remember what it was. It just time, age is failing me to remember that.
Amazing. And something that, sorry to interrupt you, but it's important to highlight what you've said just now and not let it pass easily. Is once you've done something wrong, you have to say that I've done something wrong, and then you could work on how to fix it and how to get better and how to learn from it and make other people learn from it as well. And this is the duty of candor, which again is a concept that we never heard back in overseas countries. And people from overseas, when they land here, and I ask them, what do you know about duty of candor? And they just have this, as if they've been stunned by electricity, that they don't know what to say. It's a concept that we have to do and practice every single day. Whenever any mistake happens, we have to be honest about it and be transparent about it and share how it happened and find ways to fix it so it doesn't happen again. Because our main priority is patient care and patient safety. But now we've been through all these struggles with your career and my career, and probably many of the listeners to us on this podcast. But it's important to know something about you personally. Can I ask you, what is the best city that you've been to in your life or visited, and you really have created massive memories there and you can't forget?
Well, I've just come from the Maldives. Amazing. Than before, so I think it's a completely unique place. When we go to holidays, we always move around and not settle and stuff, and learn now how to be in a place. You're stuck in a small island and you have to relax.
You have to relax, yeah.
Exactly. So
there's no option. There's no other option.
Exactly. And so that was a brilliant place, and I think when the time comes, I think I'll recommend it to anyone once in a lifetime to do it.
Amazing. Would you go there again?
I never want to go to the same place twice.
Yeah, that's interesting.
Despite the fact that I love it, because I'm sure there are lots of other nice places there that you want to see. So the only place I go more than once, obviously, is Egypt. Where I'm from.
No, something unique about English people, I have to say, that when they go to a place and they like it, they go there all the time. No. And it's fascinating. I went to Hurghada 3 years ago, and there was a British gentleman next to me, and we had a chat together, and we developed some, communication and a friendship there. And I asked him, have you been here before? He said, yes, this is my 6th time. Yeah. I said, wow, 6th time in the same hotel, which is amazing. He said, it's all good. The staff are amazing. Food is good, very safe. And he really enjoyed his time there. So, yeah.
So we went with another colleague and his wife. So we were more of us. And this was his 4th time in the same island. So that, yes, I agree with you that either Harish and to go to the same place. I would like to go to different places if I have time.
Was your friend British or not British?
Well, he's born here, born in the UK, but he's originally from Pakistan. His family, for example. I would consider him British, and so as his wife, because they lived here all their life. So you're right.
Yeah, that's amazing.
British culture.
Amazing.
Well, and I get to know one of my other colleagues as well. She works as a service manager, and she also been, I think, 11 times in the Maldives. Yeah. So
wow.
I don't know whether she's been to the same island or different island, but I loved it. But whether I'm gonna go again or not, maybe if I retire and have my all the time in my hands and all the money,
I may go there again. Yeah.
And who knows? Go again.
Amazing. It's on my bucket list to go to, but we haven't been able to go there. But we're hopefully going to be doing it soon.
Yeah, well, the interesting part is that every time it's mainly about occasions. So people say, "Oh, what occasion is this?" So we didn't go with that occasion this time. It was just an opportunity.
Happy occasion. Happy
So
occasion.
happy occasion, yeah. So maybe whenever you find the anniversary, special anniversary, or a special birthday, that's a good time. And they actually, my friend had his 60th birthday, and they really did a nice celebration for him.
Wow. Wow.
Yeah,
Amazing.
he had a really good time from the people there.
Amazing. And on this happy note, we really want to thank you so much for your time and for your valuable information and for being generous with your experience and sharing it with us all for our speakers to benefit from it. It's been a pleasure talking to you. It's been a pleasure having you on the show today. And I'm confident this is not going to be the last one. Maybe this is the first, but it's not going to be the last, definitely. So,
An absolute pleasure. And also thank you very much for taking the opportunity to to give the experience to all people coming from abroad. It's something that we've never really had an opportunity for, and I think I would recommend that everybody watch any videos. I don't think there is any similar opportunity on the media or social media. So I think it's amazing that you've managed to put that in your career, really, and give us on the experience. Thank you.
well, thank you for your kind words. And I have to say, it takes a lot of time, effort, and dedication to do this. So I really hope that all the listeners will appreciate and start to follow and start to implement things. This is more importantly to listen and implement and get some insight so they can reflect on their journey, become better at it, and become successful in the NHS and the UK to provide best patient care. Dr. Yousef, thank you so much again for your time, and we'll definitely meet again. Thank you and goodbye.
It's a pleasure. Thank you very much.